Welcome to Deep Dive. We're the place you come to get under the hood of those big, complex, global documents, the ones that really steer the ship and figure out what actually matters quickly. Today, we are tackling a major one, the World Health Organization's Comprehensive Mental Health Action Plan. It's been updated, runs through 2030, and it's essentially the global game plan for mental health. So our job today, break this down. We want to get a real sense of the sheer scale of the challenge it's addressing and lock onto the four core objectives that are meant to drive everything for the next few years. And it all hinges on this one core idea, doesn't it? The big principle: no health without mental health. Okay, let's get into it then. Before we even talk solutions, we need to grasp the crisis level we're dealing with. The WHO's definition is key here. Mental health isn't just not being sick.
Exactly. It's foundational. It's about, realizing your potential, handling everyday stress, contributing productively, being resilient.
Right.
And that ties right into the WHO's overall definition of health, that complete state of physical, mental, and social well-being, not just the absence of disease. So mental health is baked right in.
Integral, not optional.
Precisely. But the reality on the ground, well, it's pretty stark. And that's where the action plan's urgency really comes from. The treatment gap is maybe the most jaw-dropping part. Get this. In low and middle-income countries, somewhere between 76% and 85% of people with severe mental disorders get no treatment at all.
Wow. 76 to 85%. That's almost everyone in some places.
It's staggering.
And it's not just an issue over there, is it? Because even in high-income countries, the gap's still huge, 35% to 50%. So if failure is systemic, it just looks different depending on where you are.
That's right. And you see that failure reflected in the money, too, or the lack of it. Globally, we spend less than $2 per person on mental health each year.
$2.
Globally, on average. And in low-income countries, it plummets to less than 25 cents per person. We're just fundamentally underinvested.
Okay, but here's the twist that really gets me, and it feels like the heart of the problem this plan tackles, where the money is being spent. You said 67%, two-thirds goes to standalone mental hospitals.
Yes, that's the figure. Two-thirds of that already tiny global spend goes into these long-stay institutions.
But the plan itself flags these places for poor outcomes and, crucially, human rights issues. So we're pouring the majority of scarce resources into a model that's known to be problematic. That seems backward.
It is the central conflict, absolutely. And redirecting that funding is part of the biggest structural challenge the plan faces.
Makes sense.
And the cost of not fixing this, it's astronomical. The economic fallout alone, just lost productivity, lost output, is projected to hit U.S. $16.3 trillion between 2011 and 2030.
$16.3 trillion. Okay, that's not just a health issue. That's a massive economic anchor.
It absolutely is. And it connects back to mortality, too. Yeah. People with conditions like major depression or schizophrenia are 40% to 60% more likely to die prematurely.
Why is that? Is it just the condition itself?
Often, it's because the focus is solely on the mental health condition. Those standalone hospitals, that's 67% of funding, they're often not equipped or focused on treating coexisting physical issues. Things like cancer, heart disease, diabetes, HIV, they go unmanaged.
So it's a failure of integrated care.
Precisely. Yeah. And then there's suicide, still the second leading cause of death for young people globally. It's this whole picture economic drain, early death, neglect that makes the plan's goals so, well, comprehensive.
Okay, so lay out that overall goal for us again.
It's broad. Promote well-being, prevent disorders, provide care, boost recovery, champion human rights, and slash the rates of death, illness, and disability tied to mental disorders.
Okay, a huge agenda. Given that crisis context, how does the plan propose we actually turn the ship? You mentioned a clear structure.
Yes, it's built around four core objectives. These haven't changed. They provide the constant framework.
Okay, what are they?
1, strengthen leadership and governance. Basically get the laws and policies right. 2, provide comprehensive, integrated, responsive services, crucially, in community settings. Get care out of institutions.
The big shift we talked about.
Exactly. 3, implement promotion and prevention strategies. Catch things early, build resilience.
Upstream thinking.
And 4, strengthen information systems, evidence, and research. We need to know what works and track progress.
Okay, 4 pillars: leadership, services, prevention, data.
That's it. And then there are 6 principles that cut across everything, the how we do it. These are non-negotiable.
All right, what are these guiding principles?
First, universal health coverage. Access for everyone without causing financial ruin. Second, human rights. All actions have to align with things like the UN Convention on the Rights of Persons with Disabilities. Dignity is key.
Access and dignity makes sense. What else?
Third, evidence-based practice. Use what science shows works. Fourth, a life course approach addresses needs from infancy right through to older age. It's not just about adults. Fifth, a multi-sectoral approach. This can't just be the health ministry's job. Education, employment, justice, housing, they all have to be involved.
Right, a whole-of-society approach.
Exactly. And finally, number 6, empowerment of persons with mental disorders and psychosocial disabilities. People with lived experience must have a real say in designing and running services. They're not just patients, they're partners.
That feels critical. Shifting the power dynamic. Okay, that framework is solid. Let's dig into some specifics now. Those targets for 2030. Objective 1, leadership and governance. You said that's about the legal foundation?
Yes, and the gap there is stark. Remember, only 36% of people in low-income countries have any mental health legislation protecting them, compared to 92% in high-income countries. No law means no rights, no funding mandate.
So the target is trying to close that gap.
Right. By 2030, the target is for 80% of countries to have developed or updated their mental health policy or law, and critically, it must be in line with international human rights instruments.
80%. That's ambitious.
It is. And there's a really powerful specific action mentioned under this objective. The option to decriminalize suicide and attempted suicide.
Ah, that's huge, isn't it? Treating it as a health issue, not a crime.
And fundamentally changes the response. Removes stigma, encourages help-seeking. It's a potential game changer.
Okay, so that's setting the rules. Objective 2 feels like where the system physically changes, shifting services to the community away from that 67% institutional spend.
Precisely. This is the core structural reform, and the targets are designed to force that change.
What are they asking for?
2 big ones by 2030. First, 80% of countries need to have doubled the number of community-based mental health facilities or services they offer.
Doubled.
Second, also, 80% of countries need to have integrated mental health into primary health care.
Right, bringing it into the regular doctor's office, essentially.
Exactly. And that integration is key to tackling the premature mortality issue we discussed. It means training primary care staff to spot and manage common mental disorders and screen for those physical comorbidities, cancer, diabetes, heart issues, providing holistic care.
So people don't fall through the cracks.
Precisely. And importantly, these services have to be responsive. They explicitly call out the need to cater to vulnerable groups, survivors of violence, LGBTQ+ individuals, indigenous populations, people with HIV/AIDS. Care must be tailored and accessible.
Okay, makes sense. Moving on to Objective 3, promotion and prevention. You frame this as the upstream action.
Yeah, because the stats show up to half of adult mental disorders actually start before age 14. So there's a huge window of opportunity early in life.
So intervening early could potentially head off some of that massive economic cost down the line.
That's the hope. And the headline target here is incredibly ambitious. It actually aligns with the Sustainable Development Goals, too. Reduce the suicide rate by 1/3 by 2030.
Wow, a third reduction globally. That's immense.
Well, it requires that multi-sectoral action we mentioned. The plan targets 80% of countries having at least 2 functioning national multi-sectoral promotion and prevention programs.
So examples for suicide prevention. It wouldn't just be therapy, right?
No, far beyond that.
Yeah.
It means things like restricting access to common means like certain pesticides or firearms, depending on the context. It means working with the media on responsible reporting guidelines. It involves schools, workplaces, social services. It's complex.
A truly coordinated effort. Okay, finally, Objective 4. Information, evidence, research. Basically measuring if any of this is working.
Essentially, yes. You can't manage what you don't measure. If we're going to make these huge shifts, we need the data to guide decisions and demonstrate impact.
So what are the targets for data?
2 main ones again. By 2030, 80% of countries should be routinely collecting and reporting on a core set of mental health indicators every 2 years. We need consistent tracking.
Right. See the trends, see what's working where.
And second, the output of global research on mental health needs to double.
Double? Why such a big jump?
Because right now, the research landscape is heavily skewed. Most studies are done in and focus on high-income countries. But the greatest need, remember that 85% treatment gap, is often in low and middle-income settings. We desperately need more research on culturally relevant, affordable, effective strategies for those contexts.
So building the evidence base where it's needed most?
Exactly.
Let's circle back quickly to that empowerment principle. You said it's about more than just asking people for their opinions.
Yes. The plan is quite clear. It calls for policies and laws that give people with lived experience a formal role and authority in shaping policy, planning services, implementing them, evaluating them. Real power sharing.
How does that work in practice? Is there a mechanism suggested?
One key mechanism mentioned is establishing supported decision-making. This helps people create things like advanced plans or directives.
Ah, so they can state their preferences for care before a potential crisis hits?
Exactly. It respects their autonomy and their right to choose, even when they might be struggling. It's about upholding dignity and rights throughout the care process.
Okay, pulling this all together, this deep dive really shows the WHO plan isn't just a wish list. It's a comprehensive, deeply ambitious blueprint for global change.
Absolutely. And it underlines that this isn't just a job for health ministries. It demands real partnership across government, education, labor, justice, social welfare. Everyone has a role.
The scale of the targets is huge, cutting suicide by a third, doubling community services globally, embedding mental health and primary care everywhere.
They are incredibly ambitious. But the plan argues, based on the data we've discussed, that they're necessary. It's about fundamentally rebuilding care around human rights, solid evidence, and genuine community inclusion.
And the alternative, sticking with the status quo, has that staggering U.S. $16.3 trillion economic price tag, let alone the human cost.
Precisely. The cost of inaction is arguably far higher than the cost of implementing this plan.
So maybe a final thought for you, our listener, to take away from this. We know the economic toll of doing nothing is estimated at $16.3 trillion. We also know that currently 67% of mental health funding often goes to those large institutions linked with poorer outcomes. Just imagine if, as Objective 2 demands, that money was deliberately redirected, shifted immediately towards integrated, community-based, recovery-focused care. The resources, in many ways, are already within the system, just profoundly misplaced. The roadmap's here. The need is undeniable.
It really puts the challenge and the potential into perspective, doesn't it?
It certainly does. Thanks for joining us.